Our team looked into an injectable hydrogel scaffold for hip fractures caused through osteoporosis. My name's Luke.
I'm Colin.
I'm Mike.
And I'm Matt.
So first, when we looked into this problem, we wanted to identify a clinical need. So annually around the world, osteoporosis causes approximately 8.9 million fractures. It affects 1 in 3 women and 1 in 5 men over the age of 50. And specifically to hip fractures, it's expected that osteoporosis is going to cause an additional 310% increase in men and 240% increase in women by 2050. So currently with hip fractures, there are some problems with the surgeries. They include irritation, discomfort at the procedural site, the cost of surgery, and the level of invasiveness that the patient occurs. So what we decided was to look into an injectable hydrogel as stated before. Total hip replacements with implants are currently seen as the gold standard, but they have some limitations such as surgical and post-surgical complications. Also, the cost and the length of stay in the hospital is definitely a negative to this procedure. With hydrogels, they've looked into using natural polymers and synthetic polymers to inject into the site, but natural polymers lack mechanical strength and they can't be used at weight-bearing sites. And the synthetic materials have been shown to produce toxic byproducts that can cause harm to the patient down the road. So we identified a need for an injectable hydrogel that could mix these two materials into one that would solve this problem.
In order to overcome this problem, we decided to go with a silica-based bioactive glass reinforced gelatin hybrid polymer, as can be seen in figure 3. With this bioglass addition, it has the advantages of increased biomechanical strength, such as compressive strength, toughness. It also has better biomineralization and more controlled biodegradation. It also mimics native bone tissue and has high osteoblastic activity. Also, we've decided to functionalize the hydrogel with alpha-2 beta-1 integrin-specific peptide due to the advantages of protected encapsulated BMP2s, attracted osteoprogenitor migration, and also it promotes mechanical bone formation. And this growth factor can be seen in figure 4. And then finally, we're considering including bone marrow mesenchymal cells by encapsulating them into the hydrogel as well to further promote bone formation. And we believe that the combination of these aspects will be able to create a injectable hydrogel that will be injected directly into the defect and will be less invasive while still being very effective.
Because we are adding multiple techniques into one product, we understand the research and development phase of the product will be pretty high. We also know that encapsulating bone marrow mesenchymal cells is a challenge during the research and development phase. As an estimate for our product, we believe it'll cost around $480. However, this product has a very low immune response compared to other products on the market, as well as being less invasive, promotes bone growth, eliminates corrosion, and shortens the hospital stay for the patients.
So, as mentioned before, the current competition and alternatives that are currently out on the market are hip implants. As you can see, there is obviously the pros are that it does work. The patient will return to normal functions and be able to do physical activity once again. However, there are a lot of complications, as mentioned earlier, both surgical and post-surgical. The surgical complications can be blood clots, hematomas, and infections. Roughly 1 out of every 100 hip implant procedures will lead to deep infections, which require full hip implant removal, and the patient can't get a new hip implant for the next 12 weeks. Post-surgical complications involve dislocations, as the hip implant can actually pop out of place and require to be popped back in, as well as wear and debris. All these materials are made out of either metal or ceramic, which will wear over time, and sometimes the debris can cause complications within the body that need to be fixed at the hospital level. It is also rather expensive for hip implants. As you can see, it costs anywhere between $2,300 and upwards of almost $13,000. Our device will be cheaper and will allow for less invasive and less complications to occur.